question is about our, what I think, and many people would agree, sick healthcare system. Having grown up under the single-payer plan in Canada, I think that's by far the best way to go, and I think many doctors are starting to agree. I'd like to hear your comments on this situation.
Well, I'm afraid I have to disagree with you. I think the single-payer system is a very, very poor system. If we go to the Canadian case, you should look at their waiting lists. They have very long waiting lines for all sorts of difficulties and diseases. Indeed, at one point, British Columbia contracted with hospitals in Washington, in the Seattle, Washington, to perform bypass operations in order to reduce the waiting time on bypass operation. You also have a situation which under single payer in Canada, physicians in Canada are moving to the United States. Canada is losing a considerable fraction of its the graduates from its medical schools to the United States. It's a bad system because a third party is involved in payment. You do not have a direct relationship between a physician and a patient. So that on the whole, I have to disagree. I think that we in the United States have gone too far in the direction of third payer payment.
Regarding bureaucracy, I know you're against it, and I want to ask you to speak, please, about the medical insurance industry as a bureaucracy, because I think that the reason that we're looking toward a single-payer system is because of the negative influence of the medical insurance industry, which started many, many years ago, and led to HMOs and led to the present discontent, which is now leading to a wish for the single-payer system. Also, with regard to regulation, how in your ideal world, would you protect the worker, the people who feel as though they are the exploited classes in the absence of regulation?
Let's start with the insurance companies. I think you haven't dug deeply enough about the source of the problem. In my opinion, the real source of the problem is the exemption of health services provided by employers from the income tax. Why is it that most people today get their health insurance through their employer? That isn't a natural thing. Why don't you get your food through your employer? You used to have company stores, and there was a lot of scandal about company stores. Mining companies in the West, when they were with no community around, would establish a store, and their workers would get their food and their clothing and their housing, everything through the company store. And we have company stores only in medicine. Why? Food is more important than medicine. Why shouldn't we say that food provided by the employer is tax exempt? The reason we have tax exemption goes back to World War II. During World War II, we had wage and price control. And with and we also had inflation. We also had a lot of money being spent by the government on armaments and big deficits and rapid money growth. And that meant that there was, as always, a shortage of workers because you couldn't raise their wages because it was illegal under the, and yet there was a great demand for them. And so employers started to provide fringe benefits. And the most popular fringe benefit was the provision of medical services. And employers did not report what they spent on medical services as the income of employees to the IRS. And the IRS, as with most bureaucracies, was kind of slow to catch on. It took it 2 or 3 years. And when it finally got on, it instructed the employers to include the cost of fringe benefits in the wages reported for income tax purposes. Well, by this time, the workers had been taking that for granted. And they emitted a howl, and a howl big enough to make Congress pass a law exempting the provision of medical services from the income tax. If one bad law, namely wage and price control, led to another bad law, which was the exemption of medical services medical provision.
How about regulation?
Well, let me go one step further, because it was that which leads to the dominance, to the fact that most people get their medical care through their employer and through insurance. Now, the solution to this is to, in my opinion, is to either to eliminate the tax exemption and cut taxes accordingly, let workers get more of their pay in cash, but let them take care of their own medical care, or medical savings accounts, which would have the same effect. And that would reduce the role of the insurance companies greatly. Medicare has also, of course, helped in this connection. Anyway, don't get me started on medical care, because that's a big subject all by itself.
What about regulation, and how do you prevent...
The question is, how do workers get protected?
Yes.
That was the question. Who protects workers? Workers are protected by competition from other employers. The way you protect workers is by enabling them to have many employers who can use their services. That's a much more effective protection than union protection. Now, union protection may be good for those in the union. It doesn't do a thing for those who are unemployed because the union keeps down the number of jobs. It doesn't do a thing for them. There's a role for union in terms of internal negotiation and bargaining with the employer. There's certainly a very important role. But there is no real role for unions in protecting workers in general.
Seattle, Washington, you're next.
Yes, Dr. Friedman, could you tell me which president during your lifetime had the best grasp of economics, and perhaps the president before you were born that was most knowledgeable?
Well, I don't know about before I was born, and it's not easy to answer your question, because there are two things involved: a grasp of economics and a principled willingness to put that economics into play. I think in some ways I would say that Richard Nixon had the best grasp of economics. He understood it most deeply, but he was not willing to follow his own principles. It was against his principles to introduce wage and price control, which he did on August 15th, 1971. And he says in his memoirs that that was the worst thing he ever did. But he did it, yet he understood what the consequences would be. Now, Ronald Reagan had a very good and clear understanding of economics. There's so much misunderstanding about Reagan. People think he was somehow an unlearned moron. That's a bunch of nonsense. He was a very intelligent and thoughtful man, and in particular, he really understood the many important economic relations. By contrast with Nixon, Reagan had principles and was willing to stick to his principles. So that, for example, one of the first things he did when he got into office in 1980 was to end the price controls on oil and gas, which was a very important thing. You know, everybody had been saying, oh, if you take off those price controls, the price of oil and gas will go up to the sky. The truth of the matter is, as Reagan understood and knew, after you took off the controls, after a brief interval, the price of oil and gas fell and did not rise.
As far as Social Security, there's a debate going on in that arena as whether or not I can take some of my money and invest it. And I'd like to personally take it all and invest it, because then I can see a profit. But is this viable? I mean, where are my arguments bad or good on this? I don't know.
Your arguments are good on this from my point of view. I believe Social Security should be 100% privatized, not simply 25% privatized. I believe that Social Security is not a good system. You know, people talk about being fair and just. Here we have a system under which you're a young man, but let's take a different case, a hard case. Here's somebody who's 45 years old and has AIDS. He's got 10 years to live at the most if he's lucky. And the government comes along and says, you have to put aside 16% of your wages for your old age. Does that make any sense? It's a crazy thing for him to be doing. Why don't we let people decide for themselves what fraction of their income they want to save for their old age and the form in which they want to save it? Social Security came out of the Great Depression. And it came out of the idea that people were not able to save and provide for their own retirement. The difficulties in the Great Depression were not due to unwise behavior by individuals. It was due to unwise behavior by government. And once you cured that unwise behavior by government, from my point of view, the ideal situation would be to let people save for themselves. Then people will say, well, but some of them will be imprudent, and they'll end up in their old age as charges upon the state. Well, I agree we ought to have a program to make sure that nobody starves. We ought to have a program, a basic safety net at the very bottom. But why should that be different for people who are there because they're old, or because they're disabled, or because they had an accident, or for other reasons? So in my ideal world, every individual would decide for himself. You would decide for yourself. At the moment, that's not politically feasible. But privatizing part of it would be at least a step in the right direction.